Hello and welcome everybody from across the world joining us live on Facebook for our show Pulse by HealthJobHub. My name is Prashanthi Naidu, founder of HealthJobHub.com. I started Pulse to connect, share, and inspire. My mission is to unveil the pulse behind the pulse. Today, I have a very special guest joining us live on Pulse. It is my honor and privilege to welcome Professor Catherine Comiskey, joining us all the way from Dublin, Ireland. Greetings and good wishes, Professor Comiskey. How are you this morning and afternoon in Dublin?
I'm very well, thank you, and delighted to be here. You're very kind, and it's a beautiful day here in Dublin, and I'm delighted to be chatting to you all the way over there in Canada.
I am so excited to have you, and you just bring back goosebumps to me just talking about Dublin and reminiscing about the beautiful Dublin mountains. And I'm so delighted to hear it's a beautiful sunny day out there.
Lovely. Absolutely gorgeous. We've had some storms, but today the sky is blue, which is nice in Dublin, and I'm just looking out here at the sea, and it's beautiful. Yes, lovely.
Stunning, stunning, stunning. Beautiful watercolored memories are in my mind right now. Yeah. To all our viewers, Pulse by HealthJobHub is a live talk show. So if you have any questions, please post them on the live chat and we will answer you. If you enjoy our show, please smash the like button and subscribe to our YouTube channel. Please also share with your network. I'd like to thank our sponsor, Proudly Irish, a food and clothing licensing company. Proudly Irish is a registered trademark. Please visit www.proudlyirish.ie or connect with info@proudlyirish.ie for licensing opportunities. Professor Catherine Comiskey holds a master's and BA degree in mathematics, philosophy, and master's in science and a PhD degree in biomathematics with statistics and epidemiology. With over 20 years research and lecturing experience in statistics and mathematics applied to healthcare, her personal research interests are substance use, child well-being, and innovation. From 2017, she has been the vice chair of the Scientific Committee of the European Monitoring Centre for Drug and Drug Addiction, a committee with a legal remit from the EU. In 2014, Prof. Comiskey was selected after an EU-wide competition to serve as an EU expert on the Scientific Committee of the EU's European Monitoring Centre for Drugs and Drug Addiction in Portugal. She has served in a range of academic roles on a range of national bodies and has acted as ministerial academic expert to the National Drug Strategy Implementation Group. Professor Comiskey has over 100 peer-reviewed publications in her research topics. She has successfully graduated to completion 12 PhDs, 1 DSc, and 1 MD. She is currently supervising an additional 10 PhDs and has 3 PhD applicants pending. Professor Comiskey has just written a new book, Addiction Debates. Addiction Debates explores the tumultuous landscape of addiction research, policy, and practice, covering all the hot topics of the day in a balanced and informative manner. On April 20th, Professor Catherine Comiskey was elected to fellowship at Trinity College, Dublin. Oh my goodness, wow, Professor Comiskey.
Wow, busy woman.
You're a mom of 8 kids, and I do remember you telling me 4 children under the age of 8 years old. Thank you for correcting me there. How did you do it? This is amazing. Congratulations.
Thank you. Thank you. Well, it's a busy life. I had 4 children under 8 at one stage. The first 2 were born in Australia when I was working over there. I loved working in Australia, but wanted to come home once they were born and have the pleasure of grandparents and aunts and all of that.
Yeah.
And I suppose, I think my family has never held me back from being an academic and from working. And I think it's really important to recognize a good husband and a good child. They're not the same. Yes. Separate people. So I think, yes, for any woman, you do need support and good childcare, certainly. You can't go to work if you don't have good childcare. So I really, and if you have a good supportive partner as well.
Absolutely. Well, hats off to you. That is fantastic. You really inspired me by that story. And your recent accomplishment and the latest accolade, being elected to the fellowships at Trinity College Dublin, that is quite an achievement. Please share more about that.
Yes, I was delighted to be elected a fellow of Trinity College Dublin. It's an accolade. You have to submit, a body of work over a number of years. I mean, it's something you build up a body of work over a number of years, and then you submit the body of work for external peer review, and the university sends the work out for international peer review from people all across the world. And if it's deemed of sufficient standard, then you're put forward to for election. So that just brings you forward to election. And then the current fellows of the college then review the external referees and the body of work, and then they elect you or not to the fellowship. So I was elected to fellowship this Trinity Monday, which was in April.
Congratulations.
The fellows... there's a very old tradition that the fellows, are part of the fabric of the college. They're part of the legal owners of the college. Because Trinity College is over 400 years old. Yeah. So there's some very interesting traditions. One of them was that we used to be allowed to shoot pheasant in Front Square. We can't do that anymore. It was right in the city. But there's fabulous tradition, beautiful tradition, beautiful old buildings, and there is beautiful traditions, and it is a recognition as an academic. So it was nice, to have the work recognized. Yeah.
That is incredible, and I'm so excited to know a fellow of Trinity College now. So thank you so much for sharing that. Please share with us your story about what inspired you to pursue your career in mathematics and philosophy.
It's interesting. I think it is probably the people you meet along the way, who give you advice. I was very fortunate in that I had a great maths teacher when I was in school. We have different levels of mathematics, and I went to a convent school, which is very traditional in Ireland in those days, and to teach the higher level mathematics in the convent school. So we had to go to the Christian Brothers. Just 3 of us out of about 100 wanted to do the higher level maths. So we went to the Christian Brothers school every morning in our uniforms, and I will have to say we had a fabulous Christian brother, a gentleman called Brother Tracy, and he was great. They gave their lives to teaching, and I know there's a lot of pros and cons and a lot of debate about the different religious orders, but I have to acknowledge that it was one person who, in terms of the maths, and then my father and mother always encouraged us said you can be whatever you want, you can do what you want, but that would have been in the 1980s and there was a recession, so I thought, oh no, I better study maths. When I go to university, I want to study maths. But I thought I'd like to study something else as well. And my brother's friend said, oh, why don't you look at philosophy? Because it's a lot of reading and thinking, and philosophy is quite logical. But obviously you have to be able to think creatively as well. Big maths and philosophy, and just very fortunate. I never had a single female lecturer in maths or philosophy throughout my 4-year degree. Yes. And then I heard about another university when I was going to do my master's, and I met a great Scottish gentleman, Professor Alistair Wood, and he said he recognized that I had a good talent for communicating sort of real life mathematics, and he said, I look at measles models in children, which interests me rather than pure mathematics. Do something worthwhile. Yes. I think that that instinct, the female instinct, perhaps. So again, a great role model, and I just emulated everything he did. When he applied to go for conferences, I applied to go for conferences. I applied for funding, and then the whole HIV and AIDS thing happened after that was in the 80s, early 90s, and I went to do the PhD, and I had a great lady then, as well as Professor Alistair Wood, Professor Heather Ruskin. And that was the first lady I ever had teach me, and that was at PhD level. And I looked at modelling, mathematical models for the spread of HIV and AIDS. So really, people you meet. Met another great gentleman in Australia, Professor Jim Cross, a big Australian man. Now, I don't know if people know about Australia, but gentlemen wear the knee socks with the garters and shorts to the knee, and like quite a character. But when I went to Australia to teach maths at the university there, they treated me like their favorite niece. They put me on every committee, and they let me do things, and I applied for grants because I'd been applying already. And again, just great people. I had a great head of department, David, who has since passed away, and so I was just really lucky that I always looked to see what can I learn from other people.
Yes.
I saw, what people were doing. And Jim Cross, that particular gentleman, he was the head of school. David McDonough was, McDougall was the head of department, and he was kind and gentlemanly. But Jim Cross was an international thinker. So I picked up from both of them. I learned from both of them different skills. So I've always been looking, what can I learn? What can I learn? I've got this hunger for knowledge. What can I learn from these people? So I've been very fortunate, met great, usually men, I'll have to say.
Yes.
Fortunate. I mean, I've met, others who weren't so nice, but I've been lucky, yeah.
Extremely inspiring, and I'm so glad that you were able to pave the pathway for more women to come into these professions and to be able to excel. And look at you, a fellow now at Trinity College, like one of the oldest universities in the world. That is just phenomenal. So yes, congratulations. Thank you for sharing that. Please share with us also the journey into healthcare and becoming the head of the School of Nursing and Midwifery at Trinity College Dublin, and becoming a professor in healthcare statistics.
Yes. Well, I suppose it surprises me too, how a mathematician ends up as a head of School of Nursing and Midwifery. Again, I think part of it was the vision of actually a great lady, Professor Cecily Begley. I was actually teaching in the maths department, and I saw that there were some professor positions going in Trinity College in the School of Nursing and Midwifery. And Professor Begley is Professor of Midwifery. And I think she was the head of school at the time, and she had the vision. She could see that I would be an addition to the school in terms of my quantitative skills, because they had the nursing and midwifery expertise. So good to bring in somebody with different expertise. And I had worked in healthcare. I had worked in clinical trials. I'd worked my models, my mathematics, and that were in measles and in HIV and AIDS and in substance use. So, I was fortunate, and she asked me when I got the job if I'd take the role of director of research. So my role was to develop the research within the school, and I started developing research education days, master classes. We had a great program of visiting professors. So I developed that. And then after the school had an external review, and the external reviewer said, you really maybe need to get back to practice as well, doing research and practice. So as director of research, they asked me to set up a centre for practice and healthcare innovation. So that got me involved in innovation. So I worked with the hospitals. We've got great hospitals, St. James's Hospital and Tala Hospital are two linked hospitals. So I developed research with the nurses in the hospitals, nurse-led research. And we also looked at innovation, worked with Intel, School of Nursing and Midwifery, because Intel need to know how patients are going to react with technology. So it was a lovely marriage of the two. And so I did all that. That was maybe 6 years. And then the head of school came up, the vacancy came up, and you have to be elected. So I wanted the role because I wanted to test my leadership. I wanted to learn more about leadership. And I had been in the school 6 years at this stage. So I was very fortunate I was elected. You have to be elected. The colleagues, both the academic and the administrative colleagues, did vote me to be head of school. So I did that for over 3 years. Yes, that's how I got there. First non.
Congratulations. That's
Yes.
absolutely fascinating. And, I know your work just doesn't stop in Ireland and Dublin. Please tell us a little more about the work you did in South Africa with the African Doctoral Academy
Yeah.
ADA
Yeah.
at Stellenbosch University.
Yeah, I absolutely love this work. I go to Stellenbosch twice a year. Actually supposed to be there this July, but we're going to be doing it online.
Yes.
So it's all African academy. So we have African doctoral candidates, people who are doing their PhD from all over Africa, come to Stellenbosch for a 2-week PhD program.
Mm-hmm.
So I'm most interesting, most innovative, and it's such learning for me. Even though I'm there to teach and to facilitate learning, I learn so much from the students. So these could be other university staff who are doing their PhD.
Yes.
They could be people in government ministries all across Africa doing their PhD. And my role, usually my workshop is on usually experimental design and analysis. So I help people design their research. When I was there in January, this photograph was taken in January.
Wow.
I was working with a lot of environmental scientists and learning an awful lot about water. And I mean, water is so important. So I was working with a lot of the PhD candidates were working on water quality and water issues across Africa.
Yes.
So that's what I've been doing. They also do qualitative. They might do programming in SPSS or programming in OR. They have other modules, but my weekly module is experimental design. And the other module I teach then is ethics and good research practice.
Wow.
Yeah, it's just so rewarding. It
Yeah.
really is. I learned so much from it, and it's a fabulous school and very, very well run. There's fabulous staff there. Professor Sarah Howie is the director there, and Corina and Amalsha would be running the programs. Yeah, they're a fabulous team.
That is incredible. And I'm like so excited for you that you get to go to this beautiful country, my country, South Africa, twice a year and get to be involved with doctoral candidates. Like that is absolutely fascinating, and great job, and continue the good work into that. Now, I'm really looking forward to hearing about your new book. Please share with us Addiction Debates. How does that come about?
Well, I do. When I started the work on HIV and AIDS in Ireland at the time, a lot of the people who were suffering most were actually people who used drugs. So I started getting involved in addiction research and using my numerate skills to look at addiction. So that was the book. It's available in hard copy and in an ebook from Sage at the UK. So there's so many debates going on at the moment in this topic. For example, the legislation in Canada is different to lots of, say, different to the US, which is different to Europe. So it's very hard for healthcare professionals to keep up to date, and also for educators. So the book really was to bring the international evidence from all over the world together on the different debates. Say, for example, cannabis legislation, the opiate epidemic, children whose parents use drugs, that's a huge aspect. Aging and drug use is another aspect. We have people who've been using opiates, maybe the baby boomers as they're called, but now we also have prescription misuse as well. So amongst older people, the question of stigma, the question of international controls. So I just needed to get it out of my head because of all the work I'm doing, and I wanted to get it down on paper. I have great access to knowledge through my work with the EU and through my travel and my work with the Irish government. I have access to knowledge, and I wanted to synthesize that knowledge, both for my own students, because I teach addiction at undergraduate level, and for healthcare professionals, because it's so difficult to keep up. So I just really needed to get it out of my head and onto paper, and that was my motivation.
Oh my goodness, that is absolutely phenomenal. And I would like to, wish you the very best with that, the book launch. I know it's just newly launched, so I encourage everybody out there who's interested in addiction debates to get a copy. It sounds extremely fascinating to me as well. In Creating Pulse, one of our goals is to have our finger on the pulse. Please tell us a little more about the new research grant that you have been you've obtained to estimate the number of asymptomatic cases of COVID-19?
Yes. So this builds upon my sort of epidemiology modeling work. It's a real challenge to find out the hidden numbers. So I like to use my math skills to look at those real problems. So I had done some work on HIV and AIDS, trying to see how many people actually were HIV positive, because we only had the cases that were notified, but what about those that were positive and didn't know? And a similar problem arose with the number of people, say, in Ireland using heroin in the past. There's those in treatment, but how many are not in treatment, and aren't in contact? And, we should be planning services for these people. So it's about finding out the number of hidden cases. So I thought it's COVID-19. I mean, the world we're in a pandemic, and my family and your family and all over the world, where has this come from? So the Health Research Board and the Irish Research Council in Ireland put out a call for people to send in ideas for research grants. So I said I would try and look at the asymptomatic cases, because if we know how many people have actually had it, then when we want to do our opening up our communities, we'll say, well, actually, how many are actually at risk? Because people have had it and they don't know they've had it. We're then in the future looking at maybe vaccination. How many will we need to vaccinate? Again, we'll need to know how many have had it. So we can make all those plans. So that's the research grant. So I'm building on work I've done previously to look at the known cases, look at the incubation period, and try and work out using statistical and mathematical models the number of hidden cases. But it's work I've done before, so I'll just be applying it now. It sounds simple, but it'll be difficult. I'm going to apply it now. So I don't know if your viewers can see the pictures, can they?
Yes. Please tell us more about the picture I have on screen.
My daughter took this picture. It's of our television. I was asked to come on. We have this program called Prime Time in Ireland. It's on after the main evening news. I was actually asked to come on and speak about that work. So my daughter was so proud of her mother, which was nice. One of my three daughters took this picture, and I was talking. It was around Easter, so I wore a yellow dress for Easter. I'm still a woman.
Stunning, by the way. When you sent me this photo, I was like, oh my goodness, that color is just beautiful. It complements.
We still like our dresses.
Yes, 100%. And that's one thing I actually miss so much about Dublin. Everybody took the opportunity to dress up, and the clothes were absolutely fantastic. I have to say, it's not the exact same atmosphere here in Calgary. 6 months or maybe more than 6 months of the year, it's cold. So people tend to be dressing up a little bit less, glamorous. And I just love that color. It just reminded me so much of that. So
well, it's Easter color in Ireland, and we love Easter. It's a great celebration. The start of spring, but was actually a hidden message to that, because everybody was so worried. And I have 4 young adult children, and I'm involved with schools and universities and other mothers and and families, and I'm aware of how worried people are. So I want to be more positive and say, look, it's spring. Be sensible. We have to self-isolate. We have to be sensible, but it will pass, and we still will be doing social distancing, but we'll just be sensible, and I was trying not to worry people, because people are worried, and I know that.
100%. Yeah, well, I think you might have, I didn't watch the show, but just judging from the Twitter feed, I could imagine that you might have inspired a whole lot of people who were watching. And being on prime time, that is another accolade that I have to say congratulations to. I know it's a very, well-watched program in Ireland. So well done. Please share with us, in relation to COVID-19, what's the situation in Dublin at the moment? What has been the impact in your community? Has it slowed down the infection rate, or has it just stabilized, or is it still increasing?
At this point now, we have flattened the curve. We did get good leadership, I will say. We got clear leadership, and it was came in very quickly. So we were very fortunate in that the schools were closed immediately. Our university was closed, I think, even before the schools. The provost and the the senior management made the decision to close the university. So we were all at home. I've been at home since the 10th of March. So quite a long time, and but it worked. And we have been social distancing. Like all my family are at home. My son actually had been out in Vietnam backpacking, and he came home, and his girlfriend went to her home, and he came to his home, and they haven't seen one another for those 10 weeks because we're not family units are not mixing.
Yes.
So it has been, and economically, it has been very, very difficult. I think about 40% are on some government payment. So it has been very, very hard, yes. But we have saved lives. The hospital was not overrun. We are seeing now, obviously, increased cases amongst older people in the nursing homes. You know, that we can be criticized for that, maybe not having the equipment, the protection equipment in nursing homes quick enough. We were focusing more on the hospitals and the acute setting. So that is, I would say, probably where we were not quick enough. We're now coming out of lockdown very, very slowly. There's 3 weeks between phase, and we've been given dates. All know. So at the moment we were only allowed to travel 2 kilometers. Now we can travel 5. Older people, I mean, my mother is 89, but I'm one of her carers. So my sister and I, we will go into her and we will take her out just for a little walk or just to get her. So yeah, it has been very difficult. Yeah, very difficult. But we're coming out. But we're worried about the second wave.
Yes, absolutely. And you know, in terms of the long care facilities that you were just talking about, it's the same in Canada as well. They have been the hardest hit sector, and it is such a shame. And I just hope that during the summer months now, people still adhere to the social distancing, requirements, because we have to be conscious about everybody in the community. It's not just our health; it's everybody's health. We are in this together. So yeah, I just hope things work out. And you're right, the second wave, there's a lot of talk about that even in Canada as well. So we can only do our best and try and keep that curve flat.
So sensible, that's what I was saying. Even as we come out of lockdown, let's not go crazy. Let's be sensible. Let's protect our children and our families, and let's, and our older people. So for example, we're now allowed to meet. 4 people are allowed to meet. So my husband and I met another couple in beautiful park, and they had their picnic blanket and we had our picnic blanket, and we set the 2 meters apart, and we just had conversation and tea. We had our tea. We were able to have that input of friends and conversation, and which we all need. But we kept our distance.
Absolutely.
We're allowed to do that.
We have a viewer question. The viewer first said, "Well done, Dr. Catherine. Keep up the good work." And then the next question is, you have been to South Africa. What is your take on social distancing there? Can it work effectively?
My heart is broken. It is. Well, I actually was speaking to some South Africans this week, and it is working. I'm told that the numbers are going down. But I have a blog page, and I did write a blog about how worried I am about the children of South Africa. I really am, because the townships or the informal settlements, there is absolutely no way that people can, socially distance in informal settlements. So I don't know if youth will protect people. One of my master's students is from Ethiopia, and he was telling me there's no infection in his community because 1/3 of the population are under 15. So they're very, very young. So perhaps youth will protect people. But yes, I would have my concerns. Yes.
Absolutely. Yes. No, thank you to the viewer. And, based on all the research that you have done, and especially now that you're going to be undertaking in relation to COVID-19, what is your estimation for severity and duration of the pandemic? Do you have any clues on that, perhaps?
Yes. There is a gentleman at the World Health Organization called Michael Ryan. He's leading out on part of this. And he was saying, look, we're just going to have to get used to it. It could be that it won't go away. If you think about HIV and AIDS, it didn't go away, but we learned how to live with it. So we don't have to be afraid. So until we have the vaccine, we're going to have to learn how to live with it.
Mhm.
So that would be my approach is,
Yeah.
let's not worry, but let's be sensible. Let's learn how to live with it
Yeah.
until we get the vaccine, because we are still susceptible unless we've had it. And some of us we don't know we've had it, but a lot of people are still susceptible. So we could have another epidemic. So let's just learn to live with it until we can get a vaccine. So I think it's going to be here for a while, but let's not be afraid. Let's learn to live with it as best we can.
Absolutely. And, it's coming back to what we used to do. I remember when I was growing up, you'd always take those extra precautions to wash your hands. And, it's just daily hygiene that you just really need to think about these days. And, the stressing about the hand washing, wearing the masks, I think is so important for everybody to adhere to these very minimum requirements, but they could have maximum, sort of results. So hopefully it's going to be, hopefully it's not going to be as bad as,
well, it's in our control.
Absolutely.
Look after our own, hand hygiene and social distancing. So it's good to feel, I don't feel out of control. I'm in control of what I do. So that take individual responsibility.
100%, 100%. Well, thank you so much, Professor Comiskey, for enlightening us today and sharing your incredible story on Pulse. Is there any final words you'd like to leave our viewers with before we end the show?
Oh, thank you very much. It's been a real pleasure. I suppose really just in terms of, hashtag be inspired. I work with a lot of women, and we were talking before the show about just, let life happen. A lot of the women I work with are having their families, and I say, have your family, live your life, and you can, I know it maybe to say you can have it all. I mean, I work very hard, but I also take my time off and I'll go for my walk and things like that. So I would like to say to your female viewers, don't put life on hold. Go for it. Go for it all. You can have it all. Go for it.
I absolutely love that advice. And especially after listening to your story, I am inspired by, the fact that you are so well accomplished professionally, and you have such a full, fruitful family life as well. You're really an inspiration for all women out there. So thank you so much for taking that time to share your incredible story and inspire us all. I really do believe that, by hearing somebody's story, you could have made an impact on somebody today. So, I'm wishing you the very best, and I'm wishing all our viewers the very best as well.
And thank you very much. You're very kind. It's great programs. Lovely to hear all the different lives. So thank you for setting this up, and to HealthJobHub. So thank you.
My pleasure. This brings us to a close of our live show, Pulse by HealthJobHub. I do hope that you enjoyed the show as much as I did. Please join me next week, same time on Facebook Live for our season finale. I am excited to announce that our special guest joining us next week is Annalisa Chetty, a registered nurse who will be joining us all the way from Durban, South Africa. And she will be sharing with our viewers what inspires her about being a nurse and how her career as a nurse has taken her all over the world. Please join us again next week to be inspired. And don't forget, if you enjoy the show, please smash the like button, subscribe to our YouTube channel, and share with your network. Stay safe, everybody. Thank you.